Hi, my name is Blake Anderson. I'm a physical therapist assistant student at Jeff State Community College, and I will be going over necrotizing fasciitis. I do have some notes right here that I'm going to be reading off of while I'm going to be going through these PowerPoints. Necrotizing fasciitis destroys tissues that supports muscles, nerves, and vessels. It spreads very fast, which is why early recognition is very important and crucial. It's also known as the flesh-eating bacteria. It's kind of a gross name if you really think about it, but that's what it's called. Yeah. So there is a few ways that this can happen. It can happen just simple as a bug bite, a cut on your skin. There are two ways how this can spread. But once the bacteria gets into the fascia, it releases toxins that can overwhelm your immune system. Like I said, even a cut, bug bite can trigger this, which is why it happens very sudden and spreads faster than it looks. This can also lead to sepsis. Basically, the body's response, like right here, the body's response to injury, to cause injury to its own organs, tissues, because of a life-threatening bacteria. So signs for this can be things like swelling, redness, fever. Your skin can have some blisters on it. It can have a little bit of discoloration. Your pain will be very unproportionate. So like if it's like a paper cut and it's like some of the worst pain ever, that's a sign. It's very misdiagnosed for cellulitis just because of just the signs aren't very specific. It can be a whole lot of things when you're just looking at stuff like this. So procedures, doctors will usually look at imaging and labs, but a true confirmation comes from opening the tissue surgically. This shows whether necrosis is present and how far it has spread. So when they use a CT scan or MRI, it helps detect the gases within the tissues, and stuff like labs will help determine the high lactate, high creatinine. Obviously, surgery is the gold standard, but you want to make sure with these type of labs and scans and procedures and everything that it is what it is, so you're not just opening up someone just for the fun of it before you actually know. So the population that is mostly at risk, even though older adults or people with diabetes are more at risk, younger people can still get necrotizing fasciitis, and many deal with lifelong changes afterwards. So like right here, anyone's at risk. Higher people with at risk would be people with diabetes, vascular disease, immunocompromised people, which would be like a weakened immune system. So for example, like if someone had cancer, something that would really compromise your immune system. Yeah, so the prognosis improves with quick action, but delays like even just a few hours of delays can really increase the mortality risk. The severity of tissue damage and patient's health also matters. So, like predictors for poor outcome, organ dysfunction, kidney issues, high mortality if it's untreated, and how early the patient receives treatment. So treatment is very intense. Patients often need multiple surgeries and long hospital stays. Rehab is essential for helping them regain function afterwards. So some specific treatments could be like skin grafts, wound managements, possible amputation depending on, like I said, it's really just the time frame on when you go in to get it looked at. Assuming earlier, probably won't need an amputation depending on where it is. If it's later down the road, later phases, it could be a very high possibility. Emergency surgical debridement basically just helps wounds heal by removing the dead or infected tissues. So impairments and functional limitations. So you could have tissue loss, pain, weakness, reduced range of motion for impairments, which can obviously lead to difficulty walking, transfer, self-care, endurance, need for assistive devices. So like if you have weakness, or like in the last slide, if you had to get some sort of like your lower leg amputated, obviously you're going to need an assistive device. So some long-term impacts could be possible, like I said, this is kind of reiterating the last slide, possible amputation, dependence on devices, psychological trauma, PTSD. It can really be a factor in this, and reduce quality of life. So how physical therapy can address this. So the early phases, just like anything else, there's early and later phases. So the early phases is going to be a lot of range of motion. Obviously, it's going to go from passive to active assisted range of motion activities. You can help with positioning, bed mobility, pain management. Later phases. Oh, also with the early phases, it's a lot of like encouragement. It's a lot of psychological warfare, honestly. It's a very mental thing, especially if it's if like there's some sort of, if they needed something amputated, you know. But later phases: strengthening, gait training, balance, neuromuscular reeducation, functional mobility training. So our role, I kind of went over this on the last slide, but you're going to be supportive, support, encouragement. You're going to be teaching, so teaching how to use their device safely, teaching how to do pain management, basically a whole bunch of stuff we've gone over. Device use, safe mobility when using that device, or bed mobility, and rebuild their confidence. Like I said, it's a very mental game with a lot of the patients. So some precautions and contraindications. You never want to treat this during active infection. So like if they haven't had some sort of surgery to remove the tissue, if they haven't had the amputation that's needed, if it's active, you cannot, just don't treat it. But once there is some sort of action taken, you really want to protect the graft, surgical sites, very strict hygiene, very strict personal protective equipment, and avoid overuse of healing tissue. Obviously, you don't want to agitate it, annoy the tissue. It is trying to heal. So impact on plans, goals, progression. It is a very slow progression. The plan must match the patient's healing timeline. For some, rehab lasts months, sometimes years. Obviously, everything. It depends. It depends on the patient. So yeah, slow progression, modified goals, energy conservation strategies, and focus on independence and safety. So these are the three big topics that I thought were the most important going over this. So NF is life-changing, but physical therapy helps survivors rebuild their strength, their independence, and their sense of self-confidence, self-worth. So yes, thank you.